Hey everybody, this is Dr. Chris Nelson here, and today I'm going to do a treatment planning session. So let's take a look at our patient, and yes, I'm listening to music while I'm doing this video. So hopefully that works out. All right, we're going to hit the start button. 3, 2, 1. Here we go. We're looking at a patient that came in, and he has a very nice smile. I always tell people that if they're happy with their smile, I'm happy with their smile. So this patient has a very nice smile, but he came in as a new patient with some pain on the upper right. So teeth numbers 2 and 3 on the upper right. You guys know teeth numbers, right? We were having some issues with those teeth, and he was saying they were painful and just hurting all the time. So if we look at his x-ray over here, you'll see there's some tooth decay I've outlined on tooth number 2 and tooth number 3, and both of those teeth, they're looking angry. We'd actually already referred him to a root canal specialist and got him on some antibiotics, so we're doing that, and then we had him come back for a comprehensive exam. So his comprehensive exam, this is the format that we use for all of our new patients, and we'll start off with the list of observations. So the observation list, his tooth position and shape is pretty good. He's class 1 with some crowding on the lower anterior. You can see here there's some stacking of the teeth, and that happens a lot. So class 1 with some crowding on the lower anterior. Tooth decay, 2 mesial and 3 mesial, 14 distal lingual, and some decay on 8 and 9, and which we might decide to keep an eye on. I expect all of our patients to have a long-term relationship with our practice, so I'm fine with watching some things as long as we inform the patient and give them the opportunity to decide what to do about it. So infections, we don't have any infections right now, although I am concerned about tooth number 2 and 3, and 2 and 3 are at risk of being infected due to large tooth decay, so I said see the x-ray. So we have the x-ray here. And then recession, there really isn't much recession going on. We look for if the gums move up or down. And we're also looking at missing teeth. All the wisdom teeth are missing. The gum health, there is some history of deep cleaning, and now it's time to maintain this so that we don't have to repeat SRPs or scaling and replanting. Smile concerns, our patient, we talked about there's some crowding, some rotations on the teeth, which we might decide to address down in the future. So moving over to our plan, all of our patients, we talk about a plan, and the first part of the plan is about taking care of their teeth so that they don't need dental work from me. So for this patient, supportive periodontal therapy is the recommendation at 4-month intervals, and then we want to hopefully support the bone health and minimize tooth loss. I'm hoping that we don't have to go back to ever needing deep cleaning again. Fluoride varnishes at the SPT visits, I think that's important. I tell people fluoride varnish is kind of like putting a ceramic coating on their car, or like varnishing their wood fence, something like that. But essentially it helps remineralize the teeth and protect them from additional issues. Our Carry-Free treatment rinse, that's a bleach-based mouth rinse. We really like the products that Carry-Free makes. It's 2 bottles, and you mix it together and swish with it. And if you use that, a lot of our patients with really crazy before and after cases are also on Carry-Free treatment rinse, at least before I work on them to get their gums really healthy. Switching to Sonicare toothbrushes, we recommend that, and we actually have a format for 2-way toothbrushing, which you'll see here. And this is our welcome letter, but it also has our oral hygiene strategy with a QR code that takes people to our video 2-way toothbrushing, which talks about brushing for refreshment versus vibrating for cleaning. So if you haven't watched that, you should check it out. And if you do that, you will not have new cavities, hopefully. This also talks about how we're an extended family and our interests are aligned. I want to do exceptional care for you, and I want dental work that lasts a really long time. Okay, so I'm also recommending regular checkup visits 1 time a year during one of the cleaning visits. So usually if they're coming in, 2-3 times a year, I'm going to come in at one of those visits and do a checkup and look at x-rays. So our first step for this patient, we've already done it, a root canal referral, in this case to Dr. Hinckley, that's already in process. We're also going to probably need to do buildups and crowns on tooth number 2 and number 3. And buildups rebuild the tooth because there's bacteria and old filling materials that need to come out and be replaced. And then the crown covers that whole surface so that the tooth can be restored and be really strong for a long term. Also, step 2, replace number 4 and 5. Number 4 has a really bad step on one side of the filling. It also has a really not great shape. I don't love that that filling, and I'm telling the patient that, look, that filling is huge. It probably needs a crown by dental school standards, and so I'm going to propose that. We'll talk about the pros and cons when we meet. Number 5, we might just smooth that one. The X-ray is also really large, so that might be a game time decision. When I take care of number 4, we can look at number 5, decide what to do. But I think I'm going to propose possibly replacing that filling or smoothing it. And then step 3, evaluate tooth number 14. Look, that tooth has had everything done to it. It's had one of everything. So it's had a root canal, it's had a buildup, it has a crown, and it possibly has distal decay. So can we even fix it? I mean, I'm sure there are dentists out there that would cheer and say, yes, I can fix it, but those can be really challenging. And when I tell someone I'm going to fix it, I want to fix it. So it's hard for me to say, I'm going to fix it, and then take it apart and then tell them bad news that it's not fixable. So we're going to talk about number 14, see what the patient wants to do. I have a feeling he's going to just say we're going to keep an eye on it. And then tooth number 18 on the lower left, that one has an old silver filling, and tooth number 19 has a kind of ugly looking composite filling with a little stain on the edge of it. Those ones are more on the optional or step 3, and it kind of comes down to how much the patient likes surprises. If they do not like surprises, we might want to address these before we get surprised. And then 19, if we work on that one, it's probably going to need a crown because it already has a huge filling in it. And number 18, I think I can get away with a filling on that one. And lastly, I have some language in here that talks about for tooth 2, 3, 14, 18, and 19, they just have a higher risk of being sensitive or even needing a root canal following treatment with a crown or filling due to the fractures, large old fillings, and just problems with the teeth. The fact is these teeth are more difficult to repair. So that's our overview, the observation list, the plan, and then we have our x-rays, our periodontal charting with bleeding charted. I have fine print here on expectations versus reality, revisions, and other things. And then our welcome letter. So this is how we work through cases for most of our patients. Actually, for every new patient, this is what we do. And if you like that, let me know what you think. If you have any other suggestions or if you think I'm right or wrong, I'd love to hear it. And just be kind, So I hope you're having a great day, and thanks for watching.